Hey everyone, and welcome back to Pharmacist Online. Today we're diving deep, really deep into a topic that's super important, especially if you're, newly diagnosed with diabetes or maybe just trying to understand all the treatment options out there. We're talking insulin versus oral medications. Before we get started though, just a quick reminder to hit that like button, share this episode with anyone who might find it helpful, and subscribe to Pharmacist Online so you don't miss any of our future deep dives. So, when we're talking about managing diabetes, one of the biggest things that comes up is this whole insulin versus oral medications thing. And, insulin, that seems pretty straightforward, right? You need it, you take it, but it's not always the first thing that doctors go to. So can you kind of walk us through that? Why wouldn't insulin always be the first choice?
You're exactly right. It really depends on the individual. Diabetes management, it's not a one-size-fits-all approach. And like you said, insulin is essential for some people, but it's not always the starting point. It really boils down to a few key factors, like what type of diabetes you have, how your body's responding to its own insulin, things like that.
Gotcha. So, okay, let's talk about the types of diabetes then. We've all heard of type 1 and type 2, but for our viewers out there who may not be totally clear on the difference, can you explain how those two types actually play into, this decision between insulin and pills?
Sure. So in the simplest terms, with type 1 diabetes, your pancreas, it's just not producing enough insulin. And insulin, that's like the key.
Right.
It unlocks your cells and lets the glucose, the sugar from your food, get in there to give you energy.
So it's like the fuel.
Exactly. So if you're not making enough insulin, those cells, they're starving. They can't get the energy they need.
Makes sense.
So for people with type 1 insulin injections, they're essential. They're basically replacing what the body can't make on its own. Now, type 2 diabetes, it's a little bit different. Your body's still making some insulin, but there are a couple of things that could be going wrong. One, you might not be producing enough insulin to keep up with your body's needs. Or two, your cells might be becoming resistant to the insulin.
So it's like the key is there, but it's not really working as well as it should.
Yeah.
It's a little rusty.
Yeah, exactly. The lock's kind of jammed up.
Yeah.
So the glucose can't get in as easily.
I like that analogy.
Good. And that's where oral medications can really come into play. They work in different ways to kind of help your body use the insulin it's already making more effectively.
Okay, I'm starting to see the distinction here. So you're saying that if the body's still producing some insulin, those oral meds can sort of step in and help it work better. But if there's just no insulin being produced, like in type 1, then injections are a must-have.
Exactly.
So can you give us a little more detail about how these different oral medications actually work? I know from the research you sent, there are quite a few out there, and they don't all do the same thing, right?
Right. There are several classes of oral medications. Each one has its own unique way of working. So, for example, you've got sulfonylureas. These guys, they stimulate your pancreas to just pump out more insulin. Then there's metformin, which is super common. It helps improve how sensitive your cells are to the insulin you already have. And then there are SGLT2 inhibitors, which are a little different. They actually work in your kidneys to help remove excess glucose from your body through your urine.
Wow, okay. I had no idea there were so many different mechanisms at play.
Yeah.
That's really fascinating. So if oral medications can be so effective in helping the body use its own insulin, are there ever situations where, even with type 2 diabetes, insulin injections might still be the best choice? Are there any red flags that might make a doctor say, let's go with insulin right away?
Absolutely. While oral meds are often the first step for type 2, there are definitely times when insulin might be needed right off the bat. Like if someone's blood sugar is really high when they're diagnosed, starting with insulin can get things under control much faster. Or, sometimes people try different oral meds and they just aren't working well enough to keep their blood sugar in a healthy range. In those cases, insulin might be the next step. And of course, everyone's different, so individual health factors and lifestyle, those things always play a role in the decision too.
Right, right. That makes a lot of sense. Convenience is a big factor in choosing oral medications over injection.
Yeah, for sure.
But, let's be honest. There's got to be some trade-offs, right? I mean, if one was clearly better in every way, we wouldn't even be having this discussion. So can you talk a bit about the pros and cons of each approach? Are there any differences in how well they work, potential side effects, long-term health outcomes, things like that?
You're right. There are always trade-offs. It's important to weigh those carefully.
Mm.
So with insulin injections, yeah, they're very effective at lowering blood sugar, but they do require a certain level of, commitment and can be a little inconvenient. You got to think about storing the insulin properly, carrying your supplies with you, injecting multiple times a day.
Right, it's definitely more involved.
It is. And there's also the risk of hypoglycemia,
Which is?
low blood sugar.
Right, okay.
And that can be dangerous if it's not treated quickly. Oral medications, they're definitely more convenient. Like you said, you just pop a pill and you're good to go. But, they might not work as quickly as insulin and they might not be as potent in lowering blood sugar. And just like with any medication, there's always the potential for side effects.
Of course.
And, cost can be a factor too. Some medications are more expensive than others, and insurance coverage can vary widely. Plus, how well a medication works for you can change over time.
So it sounds like there's no easy answer here. It really depends on the individual and their specific situation.
Exactly.
Okay, so if both options have their pros and cons, is there ever a case for, like, using both insulin and oral medications together?
Absolutely. In fact, combination therapy is becoming more and more common, especially for people with type 2. It's not about one being better than the other. It's about finding the right balance for each person. Sometimes using both types of medication can help you get better blood sugar control with fewer side effects than if you were just relying on a high doses of one or the other.
Interesting. So it's like a personalized cocktail.
You could say that. It's all about tailoring the treatment to the individual's needs.
I like that. It's really striking how personalized diabetes management truly is. It's not just a one-size-fits-all approach, is it?
Not at all. I mean, think about it. You could have a young athlete with type 1 diabetes. They need insulin to live, and they might use an insulin pump to get really precise control over their dosage. Then, on the other hand, you might have someone who's older and has type 2. Maybe they start with diet and exercise, then move on to oral medications, and then, maybe eventually they need to add insulin to the mix. It really is a journey, and the treatment plan should evolve along with the person as their needs change over time.
Right, so it's not a set it and forget it kind of thing. It's constantly evolving. I think that's such an important takeaway for our viewers. Don't be afraid to talk to your doctor, ask questions, and really advocate for what works best for you. Now, before we wrap up, I'm curious. Thinking back over everything we've discussed today, what were some of the key takeaways for you? Anything that surprised you or that our viewers should really keep in mind?
Well, I think it's amazing how much progress has been made in diabetes management. There are so many more options available now than there used to be, which is great. But with all these options, it can get overwhelming. So for me, the biggest takeaway is, just like you said, communication is key.
Absolutely.
Your doctor, they're your partner in this. Don't be afraid to speak up, ask questions, share any concerns you have, and really advocate for yourself to make sure you're getting the best possible care.
Couldn't have said it better myself. That's such great advice. And on that note, I want to give a huge thank you to our expert for sharing her incredible insights with us today. It's been an incredibly enlightening conversation, and I'm sure our viewers will find it incredibly valuable.
My pleasure.
And to all of you watching, thanks for tuning in. Don't forget to like and subscribe to Pharmacist Online for more deep dives on important health topics. Until next time, stay informed, stay healthy, and take care.